In this chapter, we'll talk about expanding the scope of nutrition practice and really looking at the nutrition care process and counseling. So the objectives, right, so the focus of this chapter is discussing the origins of people's food habits and behaviors and describing the use of the scope of practice framework. We'll also describe the 4 parts of the nutrition care process. This should be a review, and explore evolving areas of practice in nutrition. And so looking at the goals of nutrition counseling and education, so again, remember that we're talking about 2 closely related topics. So we have counseling, which is looking at behavior change, and then education, which is just providing people with information. Now the focus of this, of course, right, is that long-term is we want to reduce the risk of chronic diseases from lifestyle, or in our case specifically, nutrition interventions over a long period of time. Now, one of the things that we have to consider when counseling patients, and so there's a great graphic of this in the book on page 7, is looking at the origins of food habits and behaviors. And so again, you can see there's a very, very small portion at the very, very top of the graphic that talks about knowledge and level of education and how this affects our food choices. But then you see a lot of other factors go into food choices that have a significant more impact, such as cultural factors, social factors, economic, and environmental. You then also have individual choice, patterns, and personal taste. So again, you've got the food that you were raised with, the food that tastes good to you, the cost of the food that's available to you. Again, right, knowledge you can see plays a very small portion, which I think by now we all know, right, that McDonald's and fast food is not good for us, yet people still eat it. So looking at some of the factors that influence our food choices, so we have cognitive, which is our thoughts, so what we think about the food. We have our sociocultural background, so again, this is our culture, this is our socioeconomic status, this is things like finances, traditional foods we were raised on. Physical, so again, are we able to physically prepare the food, access to food, etc. And tied into that, you have geographical. So again, I believe you in community, you talked about things like food deserts, which again, these are all things that affect our food choices, even if we quote unquote know better or know what to eat. And so you can see the graphic goes into some more detail. So for example, looking at other factors, including personal, family, and cultural practices. So we have things like social occasions. So again, you'll notice that a big part of American society is that we always focus on eating, right? When you ask somebody to go out on a date, do you want to go and get food? Do you want to go to the movies? Where we'll buy food? Do you want to go out for drinks, which contain calories, right? So you'll notice there's lots and lots of involvement in the social settings with food intake. Looking at emotional states, right? We know that some people eat when we're happy and we're celebrating. We eat when we're depressed, lonely, bored. And looking at physical condition, again, can the patient actually cook for themselves? This is why we have programs like Meals on Wheels. You notice that again, as the elderly, right, become more frail, they're unable to actually physically cook for themselves, right? Lifting cast iron, standing in front of the stove for long periods of time. All these things become more difficult and influence, right, that transition to easier to prepare foods, this reliance on microwavable meals, etc. So looking at some government initiatives, and again, this is where we can kind of get some information on basic education that is provided to people nationwide. And then we have, again, we'll talk about how we gather information on what about people are currently doing and what we need to try and guide behavior changes towards. So you have from the USDA the Choose My Plate, which is your basic meal planning and education tool. So there's the online component that has a lot more of the education, different food groups, etc. We do have the National Health and Nutrition Evaluation Survey, or NHANES. Again, this is a survey of a sample of the population that then tells us what people are actually doing, what they're eating too much of, too little of, etc. And again, part of that basic education and that guidance is we have the dietary guidelines for Americans. So remember, these come out every 5 years and provide, again, that basic dietary advice and recommendations for the population as a whole, not for individuals. And so again, these come out every 5 years, so the most recent cycle is 2015 to 2020. So we are expecting the new ones to come out, which will take us into 2025. But again, thanks to COVID, they would normally have been out in about June, but I'm assuming that we're going to see them sometime next year. You then also have Healthy People 2020, which ties in and has some of the components of the dietary guidelines for Americans, which is those food goals. But Healthy People 2020, right, also has a lot more population and health goals when it comes to access to health care, lifestyle changes, etc. Now again, we should be getting Healthy People 2030. Again, I don't know the exact publication date, but that is something that is coming as well. So I believe many of you are familiar with the Choose My Plate, Again, we've had the food guide pyramid, then we had the my pyramid, then we had the choose my plate. Again, it's all the same basic concept of some basic meal planning and overall guidance. Again, it's not really for individuals, it's for populations that can be adapted then. So there is adaptations for the elderly, pediatric, etc. And there is an online component that's been significantly expanded. So again, it used to just be the food guide pyramid, which had all the pictures and the portion sizes. You notice the plate doesn't have any numbers on it because, again, there's a lot more that goes into the website now, and it's expected that people will explore the website when it comes to meal planning and food choices. Now looking at some of the food and health survey results. So this is from the International Food Information Council. So again, looking at what people are currently doing, what their interest is in food and nutrition. And so when it comes to messages, so 78% would rather hear information about what to eat versus what not to eat. And so again, this just goes to when you're looking at your educations and your messages, again, we want to be focused on positive messages on what to eat more of, as opposed to things we should not be eating. 84% were trying to lose or maintain weight. And this makes sense, right? So the US population, over 70% is overweight or obese. And so 84% of the population surveyed is trying to lose weight, so that makes sense. And 76% are trying to cut calories, right, as their way to reduce weight. So again, you also have the exercise component. 57% would rate their health as very good to excellent, but 55% of the survey was overweight or obese. And so this just kind of shows you that cognitive distortion where, again, while people may be trying to lose weight, they still think their health is already good. They may not understand how much their health is being impacted by their current lifestyle and dietary choices. So again, you kind of have that disconnect. 82% are trying to eat more fruits and vegetables. So again, everybody knows that fruits and vegetables are good for us. So again, what you see now is these changes with what if I change the access to it? Am I going to use prepared? Am I going to use different forms of the fruits and vegetables? Am I going to put them in smoothies? But again, people are aware of and are attempting to eat more fruits and vegetables. And 70% are trying to eat more foods with whole grains. So again, looking at previous dietary messages where they focus on increasing whole grain intake, right? People are aware of the benefits of whole grains versus refined grains and are trying to increase their intake. So that messaging has been effective. 69% are trying to cut back on added sugar. Again, people know that soda isn't good for them, yet they still consume large amounts of it. But again, people are aware of and are trying to reduce their intake. 68% are trying to consume smaller portions. Again, more and more people are aware of the quote-unquote portion distortion as we've now, right, increased the size of fast food servings, whether it be drinks, fries, etc. Right, they've gotten larger and larger despite changing their names to small, right, or a medium, etc. Now, when it comes to how they make their food choices, though, 83% are focused on taste. So again, we need to find a way to make healthy food taste good. 68%, right, a little over 2/3 are focused on the price, so again, looking at value and reducing cost. And 60% are focused on healthfulness. So you'll see that how healthy a food is came in as third, whereas instead people are focused on taste and price. So if you might make healthy food taste good and be cheap, people will definitely, right, be more willing to get buy-in and change their behaviors. And 60% have confidence in the safety of the food supply. As again, you've seen, right, there's just now been a recent recall on onions. So again, you can see that some of this concern is warranted as we have had multiple, right, warnings about contaminated food, right, contaminated with things like E. coli, etc. The second half of the chapter is focused on the scope of practice framework, which is really just taking a look at how counseling fits in with the nutrition care process, what dietitians are able to do and not do. And so this scope of practice framework provides us guidance on what's within our practitioner's skill set or our scope of practice. So yes, dietitians are allowed to counsel within their scope of practice and their skill set. So you've got the standards of practice and the standards of professional performance. And so again, this tells us how we do things and what we're allowed to do, what we've been trained and qualified for. And of course, you're familiar with our documentation process, which is the nutrition care process. So again, you're aware, right, the nutrition care process, you have your assessment, diagnosis, intervention, and monitoring and evaluation. So now we're just taking that same thing that we've been using for clinical patients and now looking at a counseling approach. So during the assessment process, right, our objective is to obtain, verify, and interpret data needed to identify nutrition-related problems, their causes, and their significance. And so again, remember that we have our 5 categories of data collection, which is our food and nutrition-related history, anthropometric measurements, biochemical data, nutrition-focused physical findings, and the client's personal social history. Now looking at diagnosis, so again, this is to identify and describe a specific nutrition problem that can be resolved or improved through the treatment or nutrition intervention by a food and nutrition professional. And again, the big focus has been on that we've been using is those standard diagnostic codes, which again, this is what we've been talking about throughout the M&T courses. Now remember, our diagnostic codes have three major categories. Intake, so again, you're comparing the intake of a nutrient, comparing it with needs or a standard. Clinical, medical, or physical conditions, and then behavior and environmental concerns such as attitudes, beliefs, which is what the last case study that you worked on really focused on, was looking at those behavior changes and attitudes. And again, it always follows that same structure: problem, etiology, and signs and symptoms. But now obviously with counseling, more of our diagnostic codes will probably be in the behavior and environmental, so again looking at attitudes, beliefs, behavior changes. Although of course, right, there may be some focused on intake or clinical if they're trying to change a specific nutrient as part of their behavior change, etc. Our intervention, again, purposefully planned actions intended to positively change a nutrition-related behavior, environmental condition, or aspect of health status for an individual, target group, or community at large. And so the big thing, right, is the idea is that this intervention and this whole PES statement and this whole ADIME process can actually be used at the community level as well. So for example, if an entire community is not getting enough iron, or if an entire community is getting too much of a micronutrient, if an entire community is too low in protein intake, right, then how do we also write up community interventions as well? But again, our focus in this course is on individual counseling. And then monitoring and evaluation. So again, here to determine the amount of progress made and whether goals or expected outcomes are met. So again, this ties back into your diagnosis and your intervention, which is if you want them to do something, we have to follow up on if it was successful. And so our four categories are food and nutrition related history, anthropometric measurements, biochemical data, and nutrition focused physical findings. So again, if you wanted them to gain weight, did they? If you wanted them to lose weight, did they? If you want to check on their body fat percentage, did it change? If you want to check on their labs, if you want to check on their lipids, did they improve? So on and so forth. And so again, they also have, and they talk about in this text, is the nutrition care process chains. And so again, the big thing here is that we need to connect this information, so especially for reimbursement. So again, we want to document the RDNs are using evidence-based guidelines in their counseling content. So again, this is what this class is talking about, is those specific strategies that have been shown to be effective in counseling. We want to link health outcome data with RDN intervention, which is we want to prove, right, and have in the medical record that we counseled the patient on something, they did change their diet, and their lipids improved, right? We want to show that nutrition counseling is worth it. This is how we, one, personally get reimbursed, and then two, pave the way for future dietitians that are involved in counseling. And again, we want to link the client's change through electronic medical record searches. So again, we should see the patient has been using motivational interviewing and it's been successful or not. And we can then document what stage of change the patient is in, and did we successfully move them along that stages of change model. And when they go to the next dietitian, they can continue the work, continue the intervention, and see if it's successful. And again, it's not what you did, it's what you can prove that was written down. So again, we want to have good documentation that our interventions are effective. And then lastly, it talks about is evolving the scope of practice in nutrition. And so again, the big thing here is the future of dietetics and then looking at dietitians in counseling. So again, there is the subjective global assessment tool, which again takes a look at assessing the patient holistically. There's a possibility of looking at things like narrative medicine, and some hospitals are already doing this. It's just not required as part of the medical record, where you're actually documenting, in essence, a brief narrative of what happened during the session, what occurred, what they said, what their nonverbal language was. Looking at new practice settings, which again, the book's a little bit older when it talks about this, but this is looking at, as we expand into things like corporate wellness, sports dietitians, right? There's things that, initially the only thing dietitians did was clinical and food service. And we know now, right, there's a lot of opportunities to improve health in other settings. And again, looking at evidence-based nutrition guidelines and finding what's effective, what's not effective, what we're going to continue to move forward with in the future to improve people's health and behaviors. And so with that, that's chapter 1. I thank you for your time, and I look forward to your questions.